Bismillahirrahmanirrahim. Assalamu alaikum everyone. Welcome to my channel. I am Dr. Mubashra, and in this video we will talk about top 10 mistakes students make in clinical case presentation during exams. Case presentation is the heart of FCPS, MRCP and undergraduate clinical exam. Even if you know your subject, small mistakes in case presentation can cut your marks. Let's go through these mistakes one by one so that you can avoid them. Mistake number 1. Poor introduction of the patient. Many students start presenting without proper introduction. Always begin like this. The patient is Mr. X, 55-year-old gentleman, presenting with shortness of breath for 6 months. If you forget the name and age or presenting complaint of the patient, your whole presentation looks incomplete from the start. Mistake number 2. Jumping into the diagnosis too early. Students often rush and announce the diagnosis before even presenting the full history or examination. Remember, examiners are checking your approach, not just the final answer. Build the case step by step. Mistake number 3. Missing important negative history. Suppose you are presenting a case of shortness of breath. If you do not mention that the patient has no chest pain, no palpitations, no orthopnea and no PND, examiners will assume that you didn't ask. Always highlight relevant negatives to show that you have thought about the differentials. Mistake number 4. Unorganized history. Mixing up history is another common mistake, like mentioning family history in between the presenting complaint or jumping back to the past history after examination. Examiners want a structured logical flow and stick to the sequence, like presenting complaint, history of presenting illness, systemic review, etc. Mistake number 5. Skipping vital signs or general physical examination. Never ignore the basics. Students often jump straight into systemic examination and forget vital signs. Examiner expects you to start from vitals, build the clinical practice and then move into systemic examination. Missing this step creates a poor impression on the examiner. Mistake number 6. Using jargons instead of clear language. Some students speak like a textbook, using difficult terms non-stop. Remember that your goal is to communicate clearly. Use simple, concise language so even a non-medical person could follow your logic. Examiners value simple terms more than heavy terminology. Mistake number 7. Missing relevant systemic examination. For example, if you are presenting a chest case, you should also mention cardiovascular findings because heart disease can mimic or complicate respiratory problems. Missing relevant system makes your presentation look incomplete. Mistake number 8. Overloading with unnecessary details. Another problem is giving a 10-minute story full of irrelevant details. Examiners do not want to know what time the patient had breakfast. So be focused and precise and stick to what is relevant to your case. Mistake number 9. Weak summary and impression. At the end, students often mumble a weak summary. Instead, practice to give a confident summary in the end. Highlight key findings and 2 to 3 differential diagnoses. This shows the examiners that you are thinking clinically. And finally, mistake number 10. Poor confidence and eye contact. Even if your content is correct, presenting with fear, rushing or avoiding eye contact will weaken your impression. Examiners test not only your knowledge but also confidence. Speak slowly, clearly and make gentle eye contact. Even if you forget something, stay calm. It's better than panicking. So these are the top 10 mistakes students make in clinical case presentation. If you avoid them, your presentation will be structured, confident and examiner friendly. If you find this video helpful, don't forget to like, subscribe and share it with your friends. See you in the next video. Stay blessed. Allah Hafiz.